Hello, everyone, and welcome to our event. My name is Ashley Schultz. I'm the manager of community engagement here at Grant's office. Today, we're going to be discussing the Distance Learning and Telemedicine Program, or DLT, which offers between $40 and $60 million each year to help improve education and healthcare in rural areas of the U.S. This event we're about to start here is going to focus exclusively on telemedicine projects under this grant. If you're on here today interested in pursuing education and distance learning initiatives under DLT, we actually hosted a session yesterday that was dedicated to applicants for institutes for higher education, K-12s, and other nonprofit education providers. So if that sounds like you, head back over to grantsoffice.com where you found this event and look for that education-specific one. Otherwise, welcome to today's event on the healthcare portion of this program. I want to take a quick moment to just express our own excitement for today's session. This is our third in a series of events that we're hosting in 2026 to focus on a specific grant program. So as you all know, we do dozens of webinars throughout the year on grant seeking advice in general, but our purpose of this session is actually to get far more granular on our information and far more granular on our grant seeking advice so that we can focus a full 30 to 40 minutes on just one grant that's relevant for this type of year. So I very much hope you enjoyed today's event, and if you have any feedback about this new type, please do reach out to us at education@grantsoffice.com so we can hear from you. I'd also encourage those of you in the audience today who are representing a healthcare entity to consider who else amongst your peers may benefit from today's session and then pass along the recording to them. As Amber's going to detail in a few minutes, this is a very competitive grant program, so the more folks who can learn about DLT, get themselves a competitive application, and secure grant funding for rural medicine projects, the better. Last two things before we get started, I've just got some housekeeping for you. First and foremost, you can ask questions at any time during today's event using the question and answer interface that is at the bottom right-hand corner of your screen. Feel free to submit as many questions as you'd like, and we'll get to them at the end of today's presentation. And then two, know that the session is being recorded. The recording is going to be available for download at the Grants Office website starting tomorrow. The PowerPoint slides for today's session are also going to be available in that spot. And we are, for the very first time, offering all attendees a step-by-step application workbook for the DLT grant. We'll talk about that workbook here shortly, but I'm just letting you know now that it's going to be available for download in the same spot as the slides and as this session's recording. So again, today we're talking about the Distance Learning and Telemedicine grant. It's offered by the USDA. I am joined today by Amber Walker, Grants Development Consultant here at Grants Office. Amber oversees all healthcare funding in the United States for our team and is one of our in-house experts on DLT funding. She has helped dozens of organizations just like yourself to navigate the ins and outs of DLT. And if you're a regular reader of our free magazine Funded, you're going to recognize Amber from her recent series on grant seeking from the unique perspective of grant writers in the healthcare industry. So in short, she's got a lot of grants experience, not only on DLT, but in terms of healthcare funding more generally. And I think you guys are going to learn a lot from her today. Here's a quick run through over our next 30 to 40 minutes together. Once I pass things to Amber, she's going to run through a high-level introduction of the Distance Learning and Telemedicine program. What is it? What is it going to help you pay for? Who can go after it? We want to really make sure before we dive into the nitty-gritty details of this grant that it's the right fit for you. After we've cleared those hurdles, Amber's going to tackle how to prepare a competitive DLT proposal. She'll talk about the objective and subjective scoring components and the scoring range that you're going to want to hit in order to realize funding through that program. We'll end with a quick overview of some of the additional services that Grants Office can provide you on DLT, whether you need to have someone come in and score your sites, review a draft of your proposal, or maybe you want someone to come actually put pen to paper on your behalf and write the narrative for you. So with that, I'm going to pass things over to the very capable hands of Amber to get us started. Amber?
Thanks, Ashley. Good afternoon, everybody. Thank you for joining us today to learn about the DLT program and specifically the telemedicine portion of that program. We're going to start off by talking about a high level at the DLT program, the available funding, and what an eligible project might look like. This program is funded through the USDA, so there is a particular focus on rural communities. The target for this is populations of 20,000 and under, and there's some criteria above that we'll discuss later, but know that the target is populations of 20,000 and less. The federal budget has allowed for $40 million for this program in fiscal year 26. We know that 10.76 million is already allocated for congressionally directed spending projects. So the webinar today is going to focus on that other 30 million that is going to be available through competitive grants. Award amounts range quite a bit from 50,000 up to 1 million. And most projects are coming in at above $100,000. So the award amounts tend to be on the larger side. Now, although we don't have an application open right now, it is anticipated in the very near future, with the window expected to be about 30 to 45 days. So this is actually a perfect time to be having these conversations, because 30 to 45 days is not a huge turnaround time for a large project like DLT. So conversations about this program and what your project could look like that happen before the window opens is only going to set you up for success once that green light goes off and people are starting to compile their proposals. The eligibility for this program is quite wide open. We've listed some examples of eligible healthcare applicants, but this is definitely not an exhaustive list. This is just some of the examples of funded projects. Now, most DLT projects are going to follow a really similar structure in how their project is laid out. The DLT program designates two types of sites within this program. There are hub sites and there are end user sites. The hub site can be in an urban area or a rural area, but it is always where a provider is providing their healthcare services and expertise. And an end user site must be in a rural area, and it is where the patient is residing. So where the patient is receiving healthcare expertise. There can be more than one hub site, and there can be many end user sites, but they generally follow this hub and spoke model. We kind of think of it as a bike tire where the hub is in the center, and then out from there, we find the rural endpoint users. Now, this is what a basic program looks like. We're going to take a closer look at what it can look like in practice with a healthcare project. A typical example might be a healthcare system that has an urban hospital, but a large rural reach in the region surrounding it. And again, these are just some of the types of healthcare entities that can be covered within this program. We've seen previously teledental. We've seen correctional facilities being funded through this program. So if you're providing real-time healthcare services, no matter what they are, to a rural community or rural endpoint, there's a high likelihood that you could be eligible for this program. Now, both hub sites, those urban sites with the providers, and their end user sites where the patients are eligible to receive, if needed, equipment to make this program happen, to deliver the healthcare services on both sides of the patient and the provider. So we're going to go and look at what types of technologies can be included within this project. The USDA intentionally does not give an exhaustive list of the type of equipment that can be covered because it is so broad, because there's so many different types of programs and projects that can be covered. They give generalities. So there's no blanket eligibility and there's no blanket ineligibility. It's up to the applicant to justify why the technology is a necessity and crucial to the deployment of the project. But within that, there's lots of opportunity for different type of technology to be covered. Now, the vast majority of the budget for this grant program is to be used for equipment and technology. And that's both at the hub and end user sites. So now that I've covered the high level of the program details and generally what a project is going to be structured like and the allowable technology, we can dive a little bit deeper into the components of the actual proposal. And we can think about this in three main categories. We have the objective scoring component, the subjective scoring, and the budget and vendor quotes. Now, the objective scoring is crucial to this project. It is a necessary step in order for your proposal, your project narrative, and your budget to even be looked at. So we recommend completing the application in this order. You really want to make sure your site list, so your hub, your end user sites are all together and you've got them objectively scored before you move forward and put any of your effort and your manpower into the project narrative or the budget. Because this is going to kind of make or break the rest of your proposal. So with the general idea of the program in mind, we're going to take the next steps in evaluating if it's going to be even the right fit for your program. So this is a crucial step. With the DLT program, it's a very involved application. There's multiple pieces, there's highly detailed information that you need to pull together. And so the more evaluating you do, whether if it's a good fit or not for you, the more set up for success you'll be as you move forward with the proposal if you choose to do so. So we'll continue to cover some of those preliminary considerations, but we've also gone ahead and made a workbook for you. This will help you determine if it's the right funding fit, and also will be able to help you determine if it's a good fit for you. And we will go ahead and talk about that workbook a little bit later on. But first, we'll talk about how to determine if your site list is a good fit for this program. So when you think about your site list, you think about your hub site where your provider is and your end sites where your patients are, and you will create a list. Every site that is an end user site will be scored individually. They can receive a rurality score of between 20 and 40 points. The more rural, the higher the score. And I did want to note, earlier in the call, I mentioned some criteria around that 20,000 population benchmark. If you are perhaps in a small town or a suburb that is outside, right outside of a larger metro area, it's likely going to be ineligible. You'll be considered part of a continuous urban area and not a rural area. So you'll want to be double checking that all of the sites, even if they're under that population, are geographically rural as well. In addition to those rurality points, you will also receive an economic needs up to 30 points for every site. And these scores are then averaged. So you'll get an average score between 20 and 50 or 60 points, or whatever the average comes out to be. In addition to the specific points for rurality and economic need, there is also additional special consideration bonus points. Now, the special consideration for 2026 is not available yet, but in 25, this is what they base those considerations on: the most distressed of the community indexed, as well as communities with social vulnerability, according to an index, as well as tribal lands and projects that included tribes in their service area. The special consideration points are really a use it or lose it type of situation. So whether you have one site that qualifies for bonus points or 5 sites that qualify for bonus points, you will only be able to receive 10 points in total. Now I'm throwing points and numbers and morality at you. So on the next slide, we're going to go into kind of what that means and how to make sense of all of that. When we think about our site list, those sites are averaged. So say we get an average score of 40, and then one of our sites is eligible for a bonus points, so we tack that on to the end, and that's our objective scores of a 50. The USDA will not evaluate proposals or budgets that are attached to site lists that are averaging 20 or less. So if your average score comes out to 20, you will not be considered competitive based on USDA standards. Grants Office recommends an objective score of 50 or above out of the possible 80 to be considered a competitive applicant. Now, if you are in that gray area where you're 40, 45, 46, 47, please continue to consider any modifications you might be able to make to easily bump you up over that 50. For instance, if you have 5 sites where their individual rurality scores were 40, and then you have one score at a 20, you may consider removing that site that is bringing your score down. Conversely, if you have any sites that were not considered originally, or maybe you have a partner with a very rural site and it makes sense to add, you may do so to bring that score up. You don't want to reinvent the wheel just to get that competitive score up. But if it makes sense, definitely consider that. Now, as I stated earlier, there are hub sites, end user sites, and there are hub end user sites. Hub sites are not considered part of this total score. They can be in an urban area, and so for that reason, they are not considered in the rurality. If you have a hub end user site that is being considered in that overall average and pulling it back to be strictly a hub and thus not considered, and maybe that will make you more competitive. These are some of the considerations you can take to play around with those scores. Again, if you're at a 25, there's probably not a lot you can do, but if you're in that 45 range, you may be able to make some changes. If after all of that, you're still not getting a competitive score, you may want to pivot to another grant. You're in luck. Rural healthcare is a major focus of federal funding, and there are more and more opportunities for rural healthcare, including telehealth programs that are coming out as time goes on and through the spring with the Rural Health Transformation Program and other programs coming out through HRSA. And I unfortunately don't have time to dive into all of those today, but I say that to say, if DLT is not the right fit, there may be other opportunities for you at this time. Don't spend lots of effort and time and energy into a proposal that's just not going to be a real competitive fit. So in addition to this objective score, which is crucial to the whole proposal, there are other considerations to take when considering if DLT is going to be a good fit for you. So if you can say yes to these 4 things, there's a good chance that you can have a good, strong proposal together. The number one thing is that you're focusing on providing real-time health services to rural Americans. This cannot be like an afterthought of some other project that you have in mind for this equipment. It really does need to be the primary center and fronter focus of the project. Do you have collaborators or the internal structures to make this project sustainable, not just for the project period, but after it is over? Then you have the site score that's competitive and that you're capable of meeting that match requirement. We'll talk a little bit more about the match later on, but that can get people into kind of a sticky situation if they move forward with the application, hoping they can get it in time, and then they don't, and then they have to give their award back. So make sure you've got that up front. And the healthcare focus of this program is very flexible. But one thing that you need to know is that it should be addressing gaps in service, and they will ask for data in the application. They want you to show that you are meeting a need that is not being met yet. So you want to bring your innovative ideas, you want to bring your specialty services. You really want to think about how you are expanding opportunities and not duplicating services. Now, once you've confirmed it is a good fit, you can say yes to all these things. We do recommend that you check out that workbook that we mentioned earlier on the call. This is going to be a great place for you to start getting your ideas down on paper and really starting to build out your project and drafting your proposal and really just looking at the different things that are going to go into this application. This is going to be provided to all of the webinar participants today, and you are free to share this with your colleagues, others in your network, whoever you think might benefit from reviewing this workbook, who's considering this project. I will note this is not necessarily just a general one-size-fits-all workbook. It was crafted with DLT in mind and the healthcare applicant in mind as well. So we really hope it provides a really sound landing board for all of your ideas and makes you aware of all the components you'll need to consider as you're developing your proposal. So we've covered, how to evaluate if you're a good fit. So next, it's really about diving into the process and beginning that project application. So over the next couple of slides, we'll talk about our top tips on really what that is going to look like to start getting your competitive proposal together. We've talked a lot about the objective scoring, so I'm not going to spend too much time on it here. But the subjective scoring is the narrative portion. One of my top tips for this is that as a requirement of the application, you need to reach out to your USDA state director. I recommend you do this early in the process. It would be such a shame to spend all of your week's time, energy into crafting this proposal, and then the director is on vacation for 2 weeks and you can't get a hold of them before submitting. So my tip is just to get that step out of the way early. Don't let it fall off the radar. Don't let it wait until the last minute. And our tip for the budget is the budget is such a huge piece of the whole project and the proposal. And it's a little bit atypical in that they're asking for details of your equipment. They're looking for detailed line items with costs, model numbers, make numbers, and they're looking for a required vendor quotes of the exact planned equipment. So my tip is to talk to your vendors early in the process. Hopefully they are a great resource and they are considered part of your team as you're moving forward with this application, because they're the experts and they're going to really be able to help you along the way with that portion of the application. So the project narrative in and of itself has several sections. So we're going to go a little bit even more into detail on that section next. The project narrative has some of the typical components you would expect to see, like the scope of work, specific activities and goals. And as I mentioned, USDA does want to see data on this, so make sure you're really going detailed here. They want that financial information and sustainability. So talking about the match, if you have partners, developing that cost sharing agreement. the statement of experience. They want to see you're being good stewards of funds, that you're capable of being good stewards of funds. And so having that ready to go. And then slightly atypical of a project narrative for this grant is a telecommunications system plan. This is going to be a list of all of your sites, and it's going to include all of the planned equipment, including specifications that are going to that site. So again, involving your vendors and your consultants early into that conversation is really going to set you up for success. There's a lot of details in these plans, in these system maps. And so the more details that are included, the more room for error. So you really want to make sure you're taking your time, consulting with the experts. I know me, I'm a grant writer with a grants project background. Technology is not my strong suit. So I would definitely be calling in the experts to help me really make sure I know what I'm talking about when it comes to those system maps and budget line items. And speaking of budgets, we're going to dive a little bit deeper into what that looks like next before we break before questions. But the budget considerations, as I've been saying throughout the webinar, the budget for this project is huge because so much of the project is reliant on equipment and technology and those types of expenses. The match requirement is a little bit atypical as well. When we usually think about match, most people think about a cost share. So if you have $100,000 project, you would think the USDA would give you 85,000 and you would come up with 15 for that 100,000. Well, this program, the DLT program, if you have a $115,000 project, that means $100,000 is coming from the USDA and the 15% is coming from you. So it's on top of the ask that makes up the total project cost. The vendor quotes are required for the exact equipment that will be installed, and it must be quoted in the budget. So that's pretty set in stone. So you want to make sure that you've really got it hammered down. You really know what you need before you submit, because making changes after the fact can become difficult. Again, that systems plan map diagram. Every site will have their own list of equipment, including the geographic location of the site and then all of the equipment needed to outfit that site, including hub and end user. In addition to that, then there's also the detailed line items. You really want to make this as easy as possible for the reviewers. So listing all of your sites in the same order in every section of the proposal is highly, highly recommended, and making it as easy as possible for USDA reviewers to cross-check and reference different things throughout the proposal is advised. And finally, clear justification. So everything purchased by this project must be used at least 50% of the time for the services outlined in the proposal. So that doesn't mean you can't use it for things outside of the proposal, but it needs to be very clear that the primary purpose of the equipment going to a particular site is for the services that you're identifying in your proposal. So I know I threw a lot at you, and we do plan to end the call with a questions and answer section. But first, I'm going to pass it back to Ashley to just talk a little bit more about how Grants Office fits into how we may be able to help you along the way. So with that, I'll pass it back to you, Ashley.
Thanks so much, Amber, and thank you for all that really excellent information. I'm going to give you just a second to grab a glass of water before we hop into that Q&A session. Folks, if you do have some more questions that you have not already asked in the chat, it's in that bottom right-hand corner. It says Q&A. If you don't see it, it may have to click on 3 dots to find the place to click. First off, I want to just call attention to the number of individuals who have reached out to us this week or over the last 2 or 3 months trying to understand what is happening with the US federal budget. While some states and foundation budgets, they've really remained relatively stable and reliable forms of funding, we are seeing quite a bit of discourse surrounding how and when the US federal government provides its grants. Just a lot of conflicting information coming out of the White House and Congress, cabinet members, federal agency heads, and other representatives. It can be incredibly challenging to keep track of. So if you haven't already done so, I definitely encourage you to check out our website under the Guidance to Grant Seekers tabs. We have a series of 5-minute videos on the US federal budget there. What has passed, what has not passed, how much funding is available, what changes are we seeing in the grant funding landscape, etc. All those videos are available to you on demand and are completely free on our website right now. I also want to call out Grants Office's grant writing and editing services that I referred to at the beginning of today's event. The team here, filled with folks just like Amber, we have a 25-year reputation across both the US and Canada for proposal development work. So we help organizations just like yourself to plan out and then articulate your project in a way that's going to speak to the funder's goals and their objectives. So if you followed along with today's session and you think you're going to apply to DLT, but you want to have some additional assistance to help you get across that finish line, please don't hesitate to reach out to Amber and the team here. Excuse me. We offer full proposal development in writing. So what this means for you for DLT is that you come to us with a general overview of your project, your budget, a list of your sites. Again, the more rural, the more remote, the more economically distressed, the better. And then we're going to get you a grant writer who can translate all of those ideas into a competitive narrative that you can then submit to the USDA. If you are writing a proposal yourself, but you just want an extra set of eyes, make sure you've dotted all your I's, crossed all your T's. We also have a proposal editing service that's at 25% of that full cost of grant writing. So what this all looks like, if you're interested in exploring support, the first step would be to contact us at grantwriting@grantsoffice.com. You want to come to that email having already read and worked through that workbook that Amber mentioned. You don't have to have full sentences or beautiful prose in all of the prompts. But what we do ask is that you've given each component of your project some thought, right? What sites are going to be included? What do you need to purchase for those sites? What is all that going to cost? Those types of things. And then from there, you'll meet with Amber or another member of our team to discuss your project goals and also your development needs. If you want to use this for writing, we'll get you connected to a writer who, again, will just start putting pen to paper on your behalf. We do try to give you at least 2 opportunities to review those drafts and provide feedback to make sure we've really captured your organization's goals and your mission. As you work towards that deadline, we'll give you all the application materials so that you can then upload them into the portal and click submit. So again, if this is something that you're interested in, please contact us at grantwriting@grantsoffice.com to get started. And if you follow along with today's events and you just think DLT is not for you, that's okay too. I want to call your attention to some other Grants Office services that are available. We have a research and consultation service that allows you to sit down with a consultant like Amber to talk about your upcoming projects. And if DLT is not a good fit, we can find other state, federal, and foundation grants that could support you in your initiatives. We also have project building services that allow you, again, to sit down with a consultant and build out a competitive application to an entirely different grant program. And we also have our subscription service, Grants Office Communities, which gives you access to our database of 26,000 state, federal, and foundation grants so that you can do the research and the project building all on your own inside of that platform. Communities always has a free 2-week trial, so if you haven't gone over to check it out yet, I highly encourage you to do so. So with that, I want to move things over here to our question and answer. I have, Amber, quite a handful of questions for you, but again, folks, if you have more questions, bottom right-hand corner to add more. Amber, the first question came to you pretty early in the session, but asked if mobile health units are eligible.
The answer is yes. Mobile health units are, a particular case. They're not having a fixed location on their own. So they will be called a non-fixed end user, meaning that the hub address will be used to determine rurality point consideration. So what that means is that if you have only urban hubs, a mobile health unit will not be eligible and your project will not be eligible. But if you have rural hub sites, those can be used for your mobile health units and will be scored like any regular Insight for reality's sake.
Fantastic. Thank you. That is definitely threading the needle on that type of thing. So if you have more questions about that person who asked us in the chat, please do not hesitate to reach out and we can chat with you more in more detail. I also want to call out a question in the chat that was about the list of USDA state directors. Our fantastic media coordinator, Kate, dropped a URL into the chat that gives you the full list of all USDA state directors. So if that's not a conversation that you have had just yet, and you don't know who that person is, hop on over to that website and find your state, and you'll be able to find your exact point of contact. And then, Amber, I have a question here about cash match. Are there any options beyond cash match? Would an in-kind match or a waiver hurt our chances?
So DLT strongly prefers cash match from non-federal sources. There are a lot of hoops and specifications for in-kind match written out in the documents for application guidance. So yes, there are those options, but it's like a yes, but the most competitive and preferred application are going to have a cash match.
So technically allowed, but if you can find the cash somewhere, it might give you a bit of a leg up.
Yes, with such a well-known and competitive grant program, it's going to be easy for the USDA reviewers to really prioritize those cash match applications.
Mm-hmm. And having had the pleasure of being the moderator on the DLT education webinar from yesterday, I will say this came up yesterday as well. And some of the hub sites were bringing up a note that you can definitely leverage your end user sites to help you meet that cash match. So if you're here representing a hub, don't feel like you cannot ask those rural end sites to chip in a little bit on that cash component. It does not have to be you're all coming in here as a team. It does not need to be a singular entity that's covering that match. Just make sure you keep your records straight. And then Amber, I have two more questions, but they kind of ask the same thing, so I'm gonna combine them. It's about equipment at the end site. Simulators, mannequins, there's also a virtual dissection table as part of this question. So can you comment a little bit about equipment at the end sites for, I guess, hands-on use outside of the projectors and things like that?
Yeah, so this is going to be another one of those yes, but, and answers. So I hope it's helpful. I talked earlier about how the USDA does not have blanket eligibility or blanket ineligibility when it comes to allowable technology. Now, mannequins, simulations, virtual dissection table, I think I heard, those are going to be healthcare specific, but leaning more towards that training education opportunity. So it may be an allowable expense as an overall project, like within your project, but you're going to have justification on those technologies. So if you are capable and able to have an education component as part of your DLT project where you are training healthcare professionals, that could be an allowable project cost. But it really comes down to how you're designing your project and how you're justifying those expenses. But we have seen virtual reality nurse training, simulations, and mannequins be covered expenses under the DLT umbrella. But then it comes down to maybe straddling the line of education versus that real-time healthcare service delivery.
Mm-hmm. Perfect. Thank you very much, Amber, and thanks to all of you for joining us here today. We hope that you found this to be a valuable use of your time. If you are applying to the Distance Learning and Telemedicine grant, we wish you all the best of luck. Feel free to reach out to us if you have any questions along the way or if you'd like any assistance on your application. Otherwise, we wish you all a really great day. Thanks.